I'm Laurie Powell, and I worked in the pharmaceutical industry for 10 years. It was a well-paying job, but it really compromised my integrity, and after a while, I had to stop. Medical education is influencing doctors' prescription writing habits. The process is pretty much the same for any drug. It's find a key opinion leader who's going to be your spokesperson, and that's on pharma's behalf. Pay them an honoraria to be their opinion leader and to help them craft a marketing message. From there, it goes into the literature, and you want to design literature that disseminates marketing messages through peer-reviewed journals and through notable medical journals like New England Journal of Medicine or JAMA, so that it looks like it's science. But all of those things are written by scientific writers who work for an advertising agency in the medical education department, but it's all funded by pharma. All of the scientific literature is funded by pharma. So in other words, you think that the medical education is coming from an accredited bureau, but it's really developed by an advertising agency. You start looking at data when it's in phase 2. And phase 2 is when it's in animal studies. And as soon as they have any kind of data that looks promising, and maybe some of the data doesn't look so promising, but they'll slice and dice it so that they have that one sliver of data that they can go with. All the medical writers are on staff, and then the doctor has a quick glance over. He can make some edits if he likes or not and just sign off on it. And then the article is published. When the articles are published, the lower tier docs, second tier docs, are going to be early adopters. And then we get the people that are on the fence, and the way that we influence them is we develop something called a speaker bureau. The speaker bureau programs are dinner meetings where we take doctors out to a fine restaurant, and you give them a slideshow, and you feed them, and you talk to them about the drug. But the data that's shown and all of the material that's presented always has marketing messages involved. So there's always an agenda, and at the end, to make sure that they receive that message, there's a questionnaire to make sure that they understand and they repeat back to you exactly what it is that they've learned. And so that way we can carefully, cull the message so that they are getting it. And we take people who are on the fence and turn them into advocates for the drug. As the drug gets closer to launch, and we are now turning people who don't know anything about the drug into advocates for the drug, then they're waiting for it to come. And we're priming the marketplace. We're designing marketing now for consumers that matches it, so that not only do you have the marketing messages coming down to the doctor, but you also have it coming down to the consumer so that they're waiting for it. And those two come together so that you're driving the patients into the doctor's office saying, I want that purple pill because that's exactly what I need. And the doctor is right there with the sample to give it to you, and he's right there with a prescription to write it for you. After I got out of the industry, I heard a news clip on the radio, and it was talking about a vaccine for HPV. And they were saying there's a promising drug that is soon to be launched, and they were already priming the marketplace, meaning the consumer, saying and talking about it like it was science, and saying that it was coming down the line and it was going to be a breakthrough for curing and preventing HPV in preteen girls and in teenage girls. And I remember at the time being stunned that I recognized, wow, this is marketing spin, and they're targeting pre-sexual girls talking about a sexually transmitted disease. And I thought that it was awful. I saw a commercial on television that has a child speaking into the camera saying, Mom, you wouldn't let me get cancer when you could have prevented, would you? And I thought that was the most egregious form of marketing that I've ever seen in pharmaceutical marketing in my entire career. I can remember when I worked in pharmaceutical marketing that after a day spent with a client or in a meeting where we were talking about strategy and how we were going to roll the drug out, I can remember coming home and just feeling like I just wanted to take a shower because I couldn't believe the amount of spin and just utter deception that goes on behind the scenes, all funded by pharma. It's not about patient well care. It's about making money.